This is a post-op x-ray of a bunion that I fixed. But before we get into this, let me show you the pre-op x-ray. So here's the pre-op x-ray. This patient presented with long-standing pain associated with their bunion. So when we get an x-ray, a bunion deformity is not as simple as just having a painful bump on the side of the big toe. When we look at the x-rays, we can see that it is a lot more complex than this. So with a bunion, also known as hallux valgus deformity, there's an increase in the angle between the first and the second metatarsal. In addition to this, the big toe starts to deviate in this direction over there, and I don't think my finger will show up, but the bumps on the other side of the metatarsal head over here. So surgery is considered if patients fail to respond to conservative, non-operative, non-surgical measures. And from a surgical standpoint, unfortunately, is just not as simple as shaving the bump away. So here's the post-op x-ray once again, and I'm going to walk you through what was accomplished here. What was performed is known as a distal first metatarsal osteotomy. So there's essentially a cut or fracture in the bone placed over here, and this fragment is shifted in this direction, in the lateral direction. So what that does, it reduces the angle between the second and the first metatarsal. To keep this nice and stable, you can see there's an orthopedic plate within the intramedullary canal of the first metatarsal, and it is securing that first metatarsal fragment in a good position so that it stays that way while it heals. Also, in order to get just a bit more correction within the toe bone itself, another osteotomy, I can't point to it. You can see that little black line in the toe bone, the proximal phalanx. This is called an Aiken osteotomy, and it's a wedge of bone that's removed, and by closing the wedge down, it permits a little bit more correction to bring the big toe away from the second toe. So the orthopedic system that was utilized in this case is called the Nanoplasty, and believe it or not, all this work over here was accomplished through just an incision that was about 1.5 centimeters in length.